Hi there, this is Mark Edelman, speech-language pathologist, and welcome to the teaching of talking. This particular video is going to be about robotics and speech therapy for aphasia. And this is a very, very new idea and new practice in the field of speech pathology. But technology is helpful in the field of technology, in the field of speech pathology, but there's never going to be a substitute for the ability to talk and talk freely and clearly with technology, I don't believe. Okay, so there are many people who have aphasia today and apraxia today who just don't like technology, don't like the AAC devices. If they can spell, sometimes they have a device on their phone where they can spell a word and the phone will say the word and they can communicate that way. And that's pretty good. We like to look at the recovery of talking because that's what we're committed to, and that's what we find that most people want. So this video is about robotics and how we use robotics in the teaching of talking is, as many of you know, our first focus in the work with people who have aphasia and apraxia or dysarthria is the idea that we train the caregiver. Okay, that, you've heard that a million times. Now, since the COVID came along, a lot of speech therapy has been done online. And the problem with it, I found, and I've been doing speech therapy online for 6 or 8 years now, is that there are some limitations to it. And some of the limitations include macular degeneration, comprehension, receptive aphasia. So in some cases, working with a patient online through Zoom is extremely limiting. And so there are many who just don't respond to it. The majority do, but there are still many who just don't respond to it because they don't see well, they don't comprehend well, and many just don't like technology also. Many have a very short fuse or such about the use of technology. So what we've decided to do and practice it very thoroughly is we make sure that there is a caregiver on the call, on the Zoom call. And basically, the therapy is like robotic therapy because I teach the caregiver exactly what to do, how to say it, how many words, and make various suggestions to them and have them actually be doing the actual speech and language stimulation online under my supervision where I can see them and where I can hear them. Now, there's something called a CFY, and a CFY is a speech pathology student who has to work underneath a certified speech-language pathologist and learns from that certified speech-language pathologist the ins and outs of speech therapy and the practice of speech therapy. Now, I've had many, many students through the years, and I'm accustomed to training students in what to do about speech therapy. And there's not really that much of a difference between training a student or training a caregiver. So one of the things that we do is we make sure that the caregiver is on the call, and then I'll show the caregiver exactly what to do and then have them do it. And then it's my turn, and then I have them do it. And within a short period of time, we can have our regular visits, and I basically walk that caregiver through the speech and language stimulation with that person on the call. And the person who's stimulating speech and language, the husband or the wife or the daughter or the son, can do just an exceptional job. And it's like I'm behind a control panel doing surgery in Houston, Texas, where I am right now, and people who are in California or Florida. So there are many doctors who perform surgeries in some medical centers, and the patient is thousands of miles away. And they do very successful surgery. And that's what we do with speech therapy. But we understand that sometimes a patient is not well accustomed, or they're just not a very good candidate for therapy because of certain limitations of the computer, of technology, like if a person has a visual problem or a comprehension problem. So what we do is actually do the therapy, but we do it through the caregiver and show the caregiver what to do. And the caregiver does it. And we walk them through every single procedure. We are with them every single moment of training. And they become very, very good at helping the person with aphasia or apraxia speak better. So in review, robotics are about a clinician doing therapy and another clinician or some type of robotic instrument following the directives of the physician or the individual who's doing the work can do it here, and whatever the work is ends up being done here through the robotics. But in this particular case, it's not necessarily a piece of technology. What it is, it's an actual human being who we talk with every day, who we laugh with every day, who we cry with every day, who we go places with every day. And that person who learns to do speech and language stimulation can do it throughout the day, no matter where they are. And it's just an amazing process, like robotics, like the surgeons use robotics. But in this case, it's the caregivers doing the speech and language stimulation and being as good at doing it as an expert with 50 years of experience, because these people have been mentored through online video conferencing, just like robotics, with a physician in one state and a patient in another. So this is Mark Edelman, speech-language pathologist, sharing with you an interesting concept about robotics. If you'd like to learn about how you can do speech therapy like a therapist who has 50 years experience, well, it would be a good idea for you to check out below this video. It will show you how to contact me. It will show you how to fill out a questionnaire if you want to be mentored. It will show you books that you can read that I've written on apraxia and aphasia. And we have another book that's coming out in a number of weeks on dysarthria. So these are all speech difficulties that can be improved with speech and language stimulation. But the problem has always been that sometimes, well, the COVID, we've been home, other reasons such as insurance caps, therapists moving away, other therapists not experienced and saying that your loved one has plateaued. So there's no excuse in this particular case, because I believe the best person to help a person talk is a loved one. That's how we learn to talk, and that's why we've developed the teaching of talking, so that we can help people worldwide help their loved ones speak better. So this is Mark Idelman, speech-language pathologist. There's lots of material that we can offer you, as well as individual mentoring. So we hope you'll take advantage of that. So if you've liked this little video, please give us a thumbs up. And if you'd like to subscribe, kind of hit the bell that's over there. And just know that speech and language stimulation for people who have speaking difficulties can be learned by a family member and can be very successfully utilized for months or even years. This is Mark Edelman. I hope you have a great day, a great week, a great month, a great year, and of course, a great lifetime. Bye-bye now.